Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Narula. First up, the power of exercise. We know how important it is to our general health, and that's also true when it comes to pregnancy. And an editorial published this week in the Journal of the American Medical Association focused on the importance of exercise for most pregnant women.
Using the American College of Obstetricians and Gynecologists 2015 guidelines, the article highlights a recommendation for 20 to 30 minutes of exercise most days of the week at a moderate intensity, combining aerobic and strength training. Tara, have there been any studies about how U.S. women are doing it, and just how important is exercise for pregnant women? Certain people would like to know.
That's right.
Inquiring for a friend.
So there was a small study that came out in 2016 that looked at about 250 pregnant women and asked them about their physical activity. And 60% of those women reported no leisure time physical activity. And those meeting the guidelines ranged anywhere from about 13 to 45%. So not doing so great. But I love what the authors of the editorial said, which is really that pregnancy is no longer considered a state of confinement. That exercise is not only safe, but it is beneficial. It increases your longevity, your cardiorespiratory fitness, your just overall emotional well-being, and it can decrease things like gestational diabetes, preeclampsia, problems in terms of increased risk of C-section, so less risk of that. In addition, less low back pain, less pelvic problems, and less urinary incontinence. So all good things from exercise.
But we're not talking rock climbing here, right? What kind of exercise are we talking about?
Well, the first thing, they do make a specific point of saying you have to check with your doctor, make sure it's safe for you to do it. But they're talking about things like walking, dancing, stationary bike, jogging, swimming. The things that you should avoid are things like very vigorous, very ultra vigorous stuff and high impact, say long distance running or heavy weightlifting. But I love the fact that they specifically point out a few other things. They said, you should definitely avoid boxing, in case you were tempted, ice hockey, and then my favorite is skydiving.
And scuba diving.
Well, they say scuba diving, too.
Skydiving
that wouldn't be the first thing I would say.
Yeah.
I'm going to go box.
That's on my list of things not to do in general, not just when I'm pregnant.
Well, my wife played golf the day before she gave birth both times, so, maybe it accelerates things a little bit. That's not on the list, though, golf, I don't think. So jury's out on that one.
Is she above par or below par?
That's all that matters.
She plays below par.
Okay.
She's quite good. But seriously, are there people who should not be doing this kind of thing in their pregnancy?
So there are certain groups of women who it's recommended just stick to plain walking. And those are women with sort of high-grade heart disease or lung disease, women who have severe anemia, pregnancy-induced hypertension or preeclampsia, those with problems, meaning that they're increased risk of ruptured membranes, they have an incompetent cervix, bleeding in the second or third trimester, or placenta previa.
Okay.
Our next topic, community health centers. A report from the Kaiser Family Foundation found that these centers provided care for more than 24 million patients in 2015, including nearly 1 in 6 individuals on Medicaid. How do these centers might be impacted by any new health care law is a looming question. Dr. LaPook took a closer look.
Every day at the Erie Family Health Center in Chicago, Dr. Mark Simon sees patients, mostly the working poor.
People can come in and get their cancer screenings, their blood pressure checked, their cholesterol checked, and also, I think equally important, they can have a medical home.
Dr. Simon has seen his practice dramatically expand under Obamacare. The number of patients Erie now serves has almost doubled over 4 years to more than 68,000. 63% get Medicaid. Of the 24 million people the Congressional Budget Office said could have lost their health insurance under the most recent GOP proposal, Erie Health estimates that could have included 9,000 of its patients. 61-year-old retired taxi driver Leslie Durand has heart disease, and he could be one of them. What kind of medical care were you getting before you had the insurance?
None whatsoever. All I had to do is, anytime I felt some pain, I had to go to Cook County Hospital.
To the emergency room?
I had to wake up at 3 o'clock in the morning to be there early.
You want to be the first person in line?
To be the first person in line to get inside to go to the ER.
Durand now volunteers coaching soccer. He's recovered from quadruple bypass surgery last year and dreads any change that could leave him without insurance yet again.
Anything happen, I'm gonna die. Not only me, many others.
Is this keeping you up at night?
Yes, it is. I see faces and see smiles, and I feel like that they might be slipping away.
You know, there was another man that I met, another patient when I was in Chicago, 60-year-old man born in Greece, salt of the earth, worked hard his whole life. He fell on hard times, lost his private insurance, had to go on Medicaid. He hated being on Medicaid. Even though he had it, he didn't go to the doctor because he felt there was a stigma attached to it. And he told me, and he said, I have goosebumps telling you this because I've been so ashamed I haven't even told my own kids. He said, I was so ashamed to go to a Medicaid place and show my Medicaid card, but now with Obamacare, he was able to go in and show just an insurance card. And he said nobody knew that he was on Medicaid, and nobody thought, oh, he's looking for a handout, he's poor. It's something I have to confess I really hadn't thought a lot about. Just
well, when we have this debate over Medicaid and health insurance, it's important to remember that there are human beings on the front line of these stories.
Absolutely.